Hello everyone and welcome back. So we are going to discuss the topic contraception. We have discussed the following topics. These are the discussed in the first video. These one and these are discussed in the second, third, fourth, fifth, and now this is our sixth lecture of the gynecology subject, that is contraception. So this is a little bit lengthy topic. So we are going to discuss only this one topic in this section of the video. Okay. So contraception, this is a very important topic in gynecology subject. We are having a scenario that there is a 25-year-old. There are three different types of contraceptions, advantages and disadvantages and management. We have to write that. The mechanism of action and indication and contraindication of the oral contraceptive pills. Then what are the different types of intrauterine contraceptive devices? The mechanism of action, the complications and the contraindications. Then what are the non-contraceptive uses of ACP and the contraindications of OCP? Then the contraceptive pill types and uses. Another scenario is that P8 give history of IUCD insertion few months ago, followed by lower abdominal pain, discharge, PV thread of IUCD not felt by the doctor. So what is the diagnosis, investigations and the management, and the reasons why thread isn't seen? Temporary contraception types are the benefits and temporary contraception types and what are the benefits and what are the side effects. Then there is a 38-year-old parasite comes to OPD for contraception. How you would counsel her? What are the methods of contraception? And discuss the permanent contraception. Then what are non-hormonal contraception, the methods, the side effects, the different methods of permanent sterilization. Then what are OCP, better than injectable, enumerate the difference between and enumerate the indications and contraindications. Then what is sterilization, the counseling, the advantages of vasectomy over the female, the sterilization and the complications of vasectomy. So we are having the definition of the contraception as the avoidance of pregnancy by different methods other than avoiding the coitus or hysterectomy. For these methods, the methods that are used for this purpose is known as contraception. Now we are having two broad classes of contraception, that is temporary contraception and permanent contraception. For temporary contraception, we are having the hormonal methods in intrauterine contraceptive devices. The hormonal methods are OCPs, injectables, implants, and vaginal rings. Intrauterine contraceptive devices are lips loop, copper, and hormonal. Then the permanent methods are the female methods and the male methods. The female are sterilization, that is tubal ligation, and the male are sterilization and vasectomy. Then we have the barrier methods and the natural methods. The barriers are diaphragm, cervical capes, sponges, and spermicides, and female or male condoms. Then the natural are calendar methods, the thermal method, and the coitus interruptus. The temporary methods and the permanent methods. So the temporary methods are hormonal intrauterine contraceptive devices, barrier methods, and natural methods. The permanent methods are female and male sterilization. So let us discuss the hormonal methods first. Temporary method of the contraception, it is synthetic ovarian hormones, estrogen and progesterone, which are used for this purpose in different formulations and through different routes. Oral routes are combined oral contraceptive pills and progestogen only pills and morning after pills. And the combined oral contraceptive pills are available as estrogen and progesterone. The progestogens are norethindrone, levonorgestrel, and desogestrel, and gestodine. The mechanism of actions are combined oral contraceptive pill prevent pregnancy both intrauterine and extrauterine by causing an ovulation after mucus and made it hostile to sperm count, cause endometrial atrophy which is unsuitable for implantation. Then the indications or benefits of oral contraceptive pills or combined oral contraceptive pills or non-contraceptive benefits of the combined oral contraceptive pills are to use to prevent conception, gives a number of benefits to consumers other than contraceptive, regulates the menstrual cycle and prevents menorrhagia, relieves primary dysmenorrhea, reduce the risk of fibroid, ovarian cyst and genital cancer, reduce the risk of pelvic inflammatory diseases and ectopic pregnancy. It protects against the benign breast diseases, that is non-contraceptive benefit. It is used for dysfunctional uterine bleeding, primary dysmenorrhea, ovarian cyst, endometriosis, idiopathic hirsutism, PCOS, as hormone replacement therapy, Turner syndrome, and premature ovarian failure and resistance of the ovarian syndrome. The contraindications are absolute and relative. The absolute contraindications of the combined oral contraceptive pills are ischemic heart disease and including myopathy, severe valvular heart disease, hypercholesterolemia, arterial and venous thrombosis, condition predisposing to thrombosis, for example, polycythemia, past cerebral hemorrhage and migraine, pulmonary hypertension, active liver disease, porphyric history of the serious conditions affected sex by sex steroids and, for example, trophoblastic disease. The relative contraindications are factors which increase the cardiovascular disease or venous thrombosis, such as obesity, smoking, hypertension, and family history. 6. Steroids dependent conditions, including cancer, for example, breast cancer. Factors which adversely affect liver function. Factors which dispose to arterial wall and the conditions. Now, the adverse effects of the combined oral contraceptive pills are minor and major. The minor are nausea, vomiting, weight gain, breast tenderness, and mood changes. The major are serious, that is, increased risk of DVT, hypertension, cerebral hemorrhage, and MI. And the GI major adverse effects, which are gallstones, cholecystitis, ulcerative colitis, and Crohn's disease, and then cancers. So this was the about the combined oral contraceptive pills, which is a hormonal method for the hormonal method of contraception. So we have discussed indications, the benefits, the contraindications, which are absolute and relative, and the adverse effects, which are minor adverse effects and major adverse effects. Now, progesterone only pills. So this is also called mini pill, and one pill every day without the break it is used. The indications are when estrogen is contraindicated, when combined oral contraceptive is not tolerated because of the side effects, in smokers, in women above 35 years of age, and during lactation. Mechanism of action is that it prevents pregnancy by making cervical mucus thick, which prevents sperm penetration, also cause an ovulation in some cases. Then post-coital contraception is done, that is indicated when unprotected coitus occurs, particularly around the time of ovulation, and ethinyl estradiol levonorgestrel given at start and repeated after 12 hours. Then other oral contraceptives are mifepristone and propranolol. So these were the oral contraceptives. Now, injectable contraceptions. We are having the progesterone alone, which is Depo-Provera, which is 150 mg intramuscularly, and Noresteroid, that is 200 mg intramuscularly. Then estrogen or progesterone combination. Then implants are used and vaginal rings are used. Intrauterine contraceptive devices are used, which are second most common used methods, preferable contraception in women. The indications are that who cannot tolerate hormonal contraception, poor compliance with oral methods during lactation, and when estrogen is contraindicated. The types are non-medicated lip sloop. These are S-shaped double S device made up of celestic material. Its use is now replaced by copper containing and hormone releasing intrauterine contraceptive devices, as it causes menorrhagia, dysmenorrhea, and failure rate. The mechanism of action is that FP reaction in endometrium, which includes leukocytosis infiltration, increased vascular permeability in edema. It alters the environment of endometrium and makes it suitable for implantation. Then we are having the copper containing T-shaped device, which contain copper around their body and wings. Then we have mechanism of action is FP body reaction, and copper intrauterine contraceptive devices alter the endometrial enzyme system, glycogen metabolism, and estrogen uptake. It inhibits sperm transport and affects tubal fluid and oocytes. Then hormone containing intrauterine contraceptive devices, it causes the endometrial atrophy and thickens cervical mucus in addition to the FB reaction. Okay. Now, what are the side effects of intrauterine contraceptive devices? It causes bleeding, pelvic inflammatory diseases, uterine perforations, expulsions of the intrauterine contraceptive devices, dysmenorrhea, and ectopic pregnancy may occur due to IUCDs. The contraindications are that it is contraindicated in pregnancy, in fibroid uterus, in congenital uterine anomalies, and Wilson disease, abnormal uterine bleeding, valvular heart disease, pelvic inflammatory disease, Wilson's disease, patients taking immunosuppressive therapy, and patients with previous history of ectopic pregnancy. Now, misdisplaced intrauterine contraceptive device. A displaced intrauterine contraceptive device should be managed as follows. History of the patient is taken, that is proper detailed history about the insertion of IUCD should be taken to check whether it was inserted by a trained person or by a local dye or LHP, etc. Then rule out the possible pregnancy. Then bimanual examination and perspicuum examination is done to check for displaced IUCD. The investigations are done, which are ultrasound pelvis and abdominopelvic X-ray. The management is done if in abdomen, go for laparoscopy or laparotomy and give the reasons why thread isn't seen. IUCD gets okay. If a question is asked that to give the reasons why thread isn't seen, then IUCD gets curled up. The string is too short and doctor may not reach IUCD. These are the causes: string is too high or IUCD falls off. That is IUCD perforates cervix or uterus. Okay, so this was the IUCD devices, which is the main method of contraception. Now, the third method for contraception is the barrier method contraceptions. which are for both male and female. So in male, the diaphragm is used, the cervical cape is used, sponge, spermicide, female condom, and calendar method is used. In male condom is used and calendar method is used. Now the permanent method of contraception or sterilization is sterilization, and sterilization is the permanent method of contraception and is applicable to both male and female. The indications of the permanent methods are that couple with completed family, when a woman is suffering from medical disorders which can threaten her life during pregnancy, couple has high incidence of congenitally malformed babies, and when woman is mentally handicapped. Counseling is done, that is discussion with both the partners, and decisions with clear mind and absence of the pressure. Inform couple from following facts, that is sterilization can be carried out on either partners. Reversal may not be possible. In case of female reversal required laparotomy, women are rarely conceived after sterilization. When performed through laparoscope in female partner, patient may require laparotomy. Sterilization in either partner would require surgical procedure, and couple should be given details of it. The complications of sterilization should be explained well. Okay, now for female sterilization means blockade of both tubes, which can be carried out by different methods. Laparoscopic technique, which is usually performed under general anesthesia by ligating tubes with number of laparoscopic methods. These are fallopian, Holka clips, Filchie clips, diathermy, thermal coagulation, and laser. Then mini laparotomy is done, which is alternative method of sterilization for women unsuitable for laparoscopy during puerperium. Multiple intraperitoneal adhesions, that is repeated pelvic surgeries, and endometriosis and PIDs. Pomerance technique is applied, that is Medliner's method and Jordan's procedure. Colpotomy is done, cesarean section is done, hysteroscopic technique is done, non-surgical technique is done, and hysterectomy is done. The complications are injury to bowel, urinary bladder, and major blood vessels. Patient may die due to complications of the anesthesia, gas embolism, wound infection, abdominal pain, dyspareunia, intraperitoneal adhesions, ectopic pregnancy, misconception, and request for reversal. Male sterilization is done vasectomy, that is called vasectomy, which is carried out under local anesthesia, and vasa deferentia exposed on both sides, and small portion is excised between the two ligaments. Successful results of it are confirmed by absence of sperms on semen analysis performed at 3 or 4 months after vasectomy. The complications are wound infection, hematuria, scrotal bruising, and a high number of men undergoing vasectomy develops anti-sperm antibodies, and some may complain of pain at coitus. The failure rate is 1 by 4 out of 1000. Then the reversal of vasectomy is done, which is the patency of vasa deferens can be re-established in up to 90% of cases, but pregnancy rate is poor due to development of anti-sperm antibodies. Now the benefits of vasectomy or female sterilization: more easier to perform and less expensive, can be done under local anesthesia, does not affect the sexual activity or performance, it is more than 99% effective in pregnancy, less likely to cause problems than female sterilization, and it can be reversed. Now we are having the oral contraceptive pills and injectable contraceptives. The comparison between these two: OCPs are taken orally, while the injectable contraceptives are injectable contraception and are introduced intramuscularly. Now the OCP is present in 3,4-C OCP progesterone 3 forms, that is combined oral contraceptive pill, progestogen alone pills, and morning after pills. Injectables are present in progestogen alone and in combination with estrogen. Now the oral contraceptive pills are, one has to consume them daily for 21 days of the month at the same time starting on first day of the menses, and the injectables are started within 5 days of normal periods. It has different duration, that is Depo-Provera is 150 mg intramuscularly after every 12 weeks, and norethistedate is 200 mg intramuscularly after every 8 weeks. Now OCPs has to be taken daily and may have the chance to forgotten, while the injectables has advantage of better patient compliance and is best for women who forget taking pills daily. The OCPs has 1 to 3 failure rate, and the injectables has 1 to 1.2% failure rate. OCPs regulates menstrual cycle, while the injectable causes disturbance if progestogen injectables are given alone. OCP has other non-contraceptive benefits like reducing risk of the carcinoma, ovaries, breast, etc. Injectables are estrogen-progesterone combinations and has good results, but they are given every month. OCPs prevents the ectopic pregnancy also. So these were the advantages and disadvantages and the comparison between the OCPs and the injectable contraceptives. So we have discussed the topic contraception, and we have discussed all the methods of the contraception along with the scenario. First of all, we have discussed the scenario that what are the important questions that are asked in the exam. These are the mechanism of actions, the indications, the contraindications, the different types of IUCDs, the OCPs, and the contraceptive pills. So we have discussed the definition that it is the avoidance of pregnancy by different methods other than avoiding coitus or hysterectomy. So we have two major classes of the contraception, that is temporary and permanent. In temporary method, we have hormonal and intrauterine contraceptive devices, while in permanent we have female and male methods. Okay, so in temporary methods we have the hormonal, the intrauterine contraceptive device, the barrier methods, and the natural methods. In permanent methods we have the female sterilization and the male sterilization. These are the hormonal methods. In hormonal methods we are having the combined oral contraceptive pills. We have discussed the mechanism of action of this pill, then the indications or benefits, and the non-contraceptive benefits of the combined oral contraceptive pills. Then we have discussed the contraindications, which are both the absolute and relative, and we have discussed the adverse effects, which are minor and major adverse effects. Then we have discussed the second hormonal pill, that is progesterone only pill, the indications, the mechanism of actions of it, and the postcoital contraceptive pills and the other oral contraceptives. Then we have discussed the injectable contraceptive, which is the second method for the contraception, and we have progesterone alone, estrogen progesterone combination, and we have intrauterine contraceptive devices. We have discussed the indications, the types. The types are non-medicated, which are lips, loops, and the mechanism of action of it. Then we have the copper containing devices and the mechanism of action. Then we have hormone containing intrauterine contraceptive devices, and then we have misdisplaced or intrauterine contraceptive devices. Then what history should be taken, what are the investigations that are done, the management, and what are the reasons that the thread is not seen of the intrauterine contraceptive devices. Then we have discussed the barrier methods of the contraception, which is the third method of contraception, and it is both for male and female. Then we have discussed the female permanent sterilization method, and it is both for male and female. We have discussed the indications, the counseling, and the female sterilization, which is laparoscopic technique and mini laparotomy, and then the complications of the permanent sterilization. Then the male sterilization, which is vasectomy, and the complications of vasectomy and the failure rate. Then the reversible of vasectomy, the benefits of vasectomy or female sterilization. Then we have discussed the comparison between the OCPs and the injectable contraceptions, and here we end this topic of contraception. So this is a lengthy topic, so I am uploading only this topic. In the next video we will discuss about the polycystic ovaries. Don't forget to like this video and subscribe my channel. Thanks for watching.